I must say, as through the years I go back to some of that early work and also deepen my own understanding of both the applications of the concepts as well as the articulation of what the core concept is, adaptation, I find the foundational work by Helson not only still applicable but entirely true and relevant. I do see models and theories as different, and it's as if I sort of get the question sometimes, when is your model going to grow up and be a theory? Well, they don't. You know, I think they're two separate things, and models serve their purpose by leading to theory development, education, curricular patterns, and research. But they stay models, and then at the same time the theory work is going on. The first year out of my, or second year out of my master's program to be implementing a new curriculum based on new ideas with absolutely no literature in the field with 10, 12 faculty was very exciting. And I think that, but it was actually the stimulus that kept the model growth going, in addition to a lot of other professional commitments, and Dorothy Johnson inviting me to come speak and to her class, and probably the first models class that was ever taught, and saying, now please indicate its implications for education, practice, and research. The implications for research, I think, are probably the most important piece of the model, and at this point, one of the areas of keen development.
How could I provide any kind of relevant and meaningful and congruent care to these children unless I understood their cultural background? And then this is what led me into getting some background in the field of anthropology. I had found in giving care to people that care was so powerful. In 1942 and 48 for my diploma, and from private nursing. And these patients would always tell me, it was your care that made the difference. And that concept of care made the difference really was ingrained in me early. And that's when I started saying care is the essence of nursing, the heart of nursing. And, but then I thought, how can I tie culture and care together? And how could we begin to move from the foundation of an anthropological and cultural base into a nursing theory and a perspective? And so what it really meant, and this was the first clinical field that really focused on research to generate the knowledge, but to do that we had to prepare nurses to get some foundation of different cultures, and then take them the next step into looking at it from a nursing perspective. The universality is not that universal about human care. All cultures do have care, generic and all. And there's still some cultures don't have professional care. You know, we're aware of that. So that it's going to take a while for us to identify some of the things that are going to be more universal.
Roy's adaptation theory illuminates the impact of nursing by creating the disciplinary knowledge required to guide clinical judgments and actions designed for the attainment of clinical outcomes that contributes to health. Transcultural nursing of Leininger brings to the period where there was a need for understanding cultures and planning care based on various cultural beliefs that could affect patients they care for. Telehealth nursing. It is utilized in several locations to assist patients in their homes, to chronically ill rural area dwellers, and the underserved community. Nurses provide care in rural and underserved urban areas to deliver high-quality care linked electronically with the support services of a large medical center. Nurses are the primary users of telephone triage. Nurses use a variety of information systems that can provide data to inform patient care. One of the commonly used everyday nursing practice is the nursing documentation. This expresses the entry of nursing assessments, diagnoses, and interventions that may derive from the provider order entry. The use of advanced communications technology offered benefits to Roy and Leininger's model.
When you go to the doctor, you want a compassionate expert who understands exactly what's wrong and can thoroughly explain what's happening, why it's happening, and which treatments are best for you. Unfortunately, that's not the experience many patients have. Too often, doctors are rushed and distracted with no time to explain their conclusions. Other times, visiting multiple physicians can result in different opinions. This frantic environment leaves patients feeling uncertain about their diagnosis, and for good reason. There's a better way to get a doctor's care and attention. It's called telehealth, and it's the future of healthcare delivery. Telehealth is the delivery of health-related services and information via telecommunications technologies. Clinical Fellows Telehealth platform offers you secure, private, and in-depth sessions with highly qualified and experienced doctors from the best teaching hospitals in the United States. But wait, doesn't my doctor need to examine me in person? That's a common belief, but studies from the American Medical Association show that 70% of doctor visits are merely informational and can be done equally well over telephone or video. In addition, blood tests and imaging technology are increasingly replacing the physical exam, further eliminating the need for face-to-face consultations. Clinical Fellows offers one-to-one sessions where the doctors can take their time to listen to your problems, answer your questions, and address your concerns. Telehealth comes with a slew of other benefits. You'll save time and have more privacy by seeing your doctor from the comfort of your home. You'll be consulting with the most qualified physicians in the world, and your medical information will be protected securely by our platform's compliance with U.S. healthcare regulations.
Providers may have problems adapting to new system because of the steep learning curve involved. Electronic health record systems are becoming more portable with the advent of the wireless network. They are also subject to old glitches of electric systems and breaches in security.
The adaptation model centers on 4 foundational points that are integral to the nursing process. By way of the 4 modes of physiological, self-concept, role function, and interdependence, nursing within the Roy adaptation model seeks to improve the condition of the individual. It is a framework to guide nursing professionals in the most effective way to gather information beneficial to creating a personalized approach to an individual's care plan.
I think one of the most unique aspects of community health nursing is the home visiting. By going to these families' homes, we are able to more thoroughly assess their physical environments. As well, families are often more secure and comfortable in their home environments, so they're more likely to be more open and express their views and opinions.
The nurse's ongoing contact with a family promotes trust and the development of a therapeutic relationship, both of which are foundational for effective assessment. This ongoing contact also allows for assessment to continue over a period of time. Furthermore, although the nurse can do family assessment in the clinic setting, she often visits families in their own homes. Not only are families likely to be more comfortable and therefore more open in their own environment, but also more family members are likely to be present, which then allows the nurse to focus not just on 1 or 2 family members, but upon the whole family.
When we understand the person and the context within which they are receiving health care, we can better provide more effective care that is specific to their situation.
We empower our clients to take control over their own health. However, a more precise way to see the nurse's role in empowerment is to see the nurse as creating an environment in which the family can become empowered. The nurse can create that environment by responding to a family's identified needs and concerns, promoting the family's success, for example in mobilizing resources, having and expressing a positive stance towards the family, and promoting an atmosphere of joint responsibility for acting to impact on the health of the family.
To include families in determining their own goals, I think one of the most important steps is to have them identify any issues or concerns that are present and altering family dynamics at this time, as well as getting them to brainstorm and think about possible solutions. An example that I could provide is working with a mom with postpartum depression. And through having that mom set goals, just simple goals such as go out every day for an hour. And in order to make that goal achievable, I had to brainstorm with her to see, okay, so in order to do that, what supports do you have in place? Do you have family supports? Do you have a family member you can rely on to come in to stay with your child for an hour?
One of the most important factors within this context is cultural values and the importance they hold for the individual.
We're talking about your ability to ever walk again.
That's what you're talking about. I'm talking about my family. Have you ever even heard of the Hmong people? Our religion has got rules that are way old and way set in stone and way spiritual, and you don't mess with them.
It's supposed to be reflective of being able to understand different cultures and their different needs. But as I've gone through nursing, I think it's a lot more than just understanding the culture needs and being competent in understanding what cultures do certain things. The thing that you try to focus most on in cultural competency is providing the basic needs for each individual and not just see them as a culture, but providing the healthcare as to that individual in the manner and the need that they feel is best suited for them to, for their complete and overall wellness.
Notice that outward signs of faith are common in the Puerto Rican and Caribbean Hispanic culture. In fact, strong religious traditions play an important role. Integrating religious ritual into the health plan can make a significant impact on treatment success. It is important to understand that religious beliefs may also have an impact on the perception of health, disease, prognosis, and treatment. For example, people in the Hispanic population may have a fatalistic attitude and believe poor health may simply be God's will. But simply put, maintaining is celebrating and supporting cultural behaviors that are beneficial to the patient. For example, the nurse in the earlier scenario encouraged her patient to use the ritual of prayer as a cue to take her medication.
When overlooked, this can impede our progress towards improved health. Yet, when we are aware of cultural values and use our judgment to work sensitively with respect to them, we will find that such knowledge can create an environment of trust and awareness, facilitating personalized care based on the individual and helping us to succeed in our pursuit of the adaptation model's goal, improving the individual's health, quality of life, and their ability to die with dignity.
Inside the Belke home in La Crosse, a very intimate and personal conversation is taking place.
What is your understanding of your health condition, your cancer?
Think of people that wait, then they're faced with all of these decisions that they have to make. What do we want to do? What do you suppose he would want us to do? All these things that should be talked about ahead of time. I have no fear of death. I welcome it if that is the end.
It's very unsettling to talk about my husband's death, but at the same time, I feel almost pleased that we are going to do what he wants us to do.
The discussion about end-of-life care is very specific.
Have you talked about whether you would like to stay at home, be at home to die?
And the answers have very definite implications.
If I'm not able to walk or talk, or if I'm not able to know who I am or who I'm with, then what would you want? This generally isn't the first time that people have thought about these kinds of things, and by using this interview format that we use, I think it helps ease people into the discussion of death.
As we've seen, technology is beneficial to nursing in the medical setting and is changing the way we provide health care. Advances in technology are allowing us to provide more accurate care and care in places with limited resources by way of innovations like telehealth communications and e-ICUs. These are invaluable for individuals who are in need of specialized care but are unable to access it due to limited mobility or being located in remote rural areas. Additionally, technology has found its place in nursing education. Students with busy schedules have greater access to education in the form of distance learning, as well as access to resources like free e-textbooks, crowdsourced study guides, and homework tips compiled by nursing students across the internet. Students have greater access to community support previously unavailable on a scale as large as today. These resources contribute to a nurse's ability to provide better care for individuals in the future. The Roy adaptation model allows for such technological changes when it comes to assessing and responding to factors relevant to an individual's condition. And Leininger's theory of cultural competency helps to build on the adaptation model by providing a more in-depth analysis of the conditions surrounding the individuals we care for.